Now, as COVID-19 cases continue to surge around the world, we are learning more about how the disease affects the body. Early studies and even autopsies of COVID-19 patients are now revealing risks of blood clotting, brain damage, and a condition doctors are calling silent hypoxia, where the blood is slowly starved of oxygen. Take a look. This was Bishop Tim Wambunya a few weeks after he was released from an 18-day stay in ICU. He's a walking miracle, having been one of the critical cases that beat COVID-19.
I still can't move very fast. I still can't run because then I become breathless. So those are things I have to work on and live with for the next maybe 18 months.
Even though he would get over the hurdle of being declared COVID-19 free, Bishop Wambunya would soon learn that his life and body would never be the same.
I sort of had to sign some checks the other day for an organization that I am a director of. And because I hadn't been around for about 3-4 months, they brought me about 50 checks to sign. And you won't believe I had to take a break in between the signing of the checks. I signed about 10 checks, and I was so exhausted from signing checks. And that's the other thing that I'm having to deal with, that you can't do the very simple tasks that you used to do.
Bishop Wambunya joins the list of recovering critical COVID-19 patients who are coming to terms with their much frailer bodies. As we've known for the last 7 months, COVID-19 is a disease that primarily attacks the lungs, with many recovered patients showing irreversible damage to the vital organs. However, new developments indicate the damage caused by COVID-19 goes well beyond the respiratory system.
New evidence is emerging from across the world that this disease is actually a systemic disease, a disease that has effects on your heart, a disease that has effects on your kidneys, a disease that has effects when it comes to the clotting of your blood and the coagulation of your blood.
Salvador Aguina, who recovered a few months ago, says though he feels he's gotten back to normal, some complications that arose were quite worrying.
I was having shortness of breath and some pain. And it's that shortness of breath that caused them to admit me for the second time. They had noted that there were some irregular readings of my heart, which they were trying to address. I had a high risk of clotting. So that is one of the things that they were managing while I was in hospital. So the next time when I came back, that is one of the things that they started by checking out to confirm that everything was okay.
Salvador's case is not unique. In fact, in the early stages of the pandemic, bedside clinicians noticed a lot of blood clotting in some patients.
Because this virus is new to the body throws everything at it. So there is the immune response is in overdrive. And while that having an immune response is a good thing, when it goes into overdrive, it results in some untoward consequences. One of those is that the blood becomes sticky because of the effects of the blood vessels, and also because of having an immune system on overdrive, you get the blood getting stickier, and that can result in formation of clots.
The medical fraternity is just beginning to learn more about this peculiar disease, including a new discovery. Unlike many other respiratory diseases, COVID-19 can slowly starve the body of oxygen without initially causing much shortness of breath. By the time some patients have trouble breathing or feel pressure in the chest, that is one of the symptoms listed as an emergency warning sign, they are already in dire straits.
Some people have very low oxygen saturations, and they can be able to, say, talk normally, feel normally, what has been referred to as silent hypoxemia. Part of the reason or part of the consequence of this low oxygen not triggering what we could call these symptoms of fast breathing or air hunger is that, as you mentioned, somebody could just collapse because the oxygen level, once it goes too low, then the various body organs, including the brain, are unable to function properly.
The ripple effects caused by COVID-19 is something Bishop Wambunya knows all too well. He is having to now grapple with chronic muscle which doctors said would last for 18 months. However, there was one problem he never saw coming.
But I also had a damaged nerve in my left eye, so I don't see very well using my left eye, and I'm still seeing a doctor for that. He says that's one of the post-viral infections that I picked up from the COVID.
The unseen, non-physiological effects of this disease have also taken a psychological toll on those who recover and trying to get some semblance of normalcy in their lives.
Personally, I had a lot of stress as a result of the whole event because it was traumatic for me. I had to go for several sessions for counseling on the areas of post-traumatic stress disorder, which were handled by a medical officer. And I am doing very well.
By the disease.